Thank you very much. Welcome all participants. 147 participants join in our first international conference today. And we still wait for the other participants. Oh, thank you. Welcome Professor Bisma as our first speaker. And also Prof. Farida has joining us. Welcome Professor Bisma Murti, our first speaker in this conference.
Yeah. Good morning, Mas. Good morning.
Oh, yeah. Yes. Good morning, Professor. Thank you for joining us.
Mr. Bisma Murti.
Good morning, Mbak Rahmawati.
Thank you, Prof.
Yep. Okay, 9 o'clock. Are you ready to start this program? The committee, can I start?
Yes,
can I
Mr.
start
Ari,
now?
just started.
Okay. Thank you very much.
Yes.
Thank you very much. Okay, well, ladies and gentlemen, 9 a.m. Indonesian Western Time. Thank you very much for all participants from all around Indonesia, and also some of participants from Malaysia, Thailand. Thank you very much who joined our first international conference by the trend and issue of global health in community area conducted by STIKES Rajekwesi Bojonegoro, East Java. Today, Thursday, 16 June 2022, I am Ari as the Master of Ceremony today. Assalamualaikum warahmatullahi wabarakatuh and good morning everyone. Honorable the speakers today. First speaker, Professor Bisma Murti from University 11 Maret Surakarta. And the second speaker, Professor Faridah Mosaid from Lincoln University College, Malaysia. And Mrs. Rahmawati MKes as the Chief of STIKES Rajekwesi Bojonegoro. And all the participants of the first conference today. The agenda of the conference today, the first is speaking, the second is singing Indonesian national anthem, Indonesia Raya, and March of STIKES Rajekwesi Bojonegoro. The third is opening by Chief STIKES Rajekwesi Bojonegoro and brief presentation about our theme today. Number 4 is the main agenda is the conference and discussion. Session 1 with Professor Bisma Murti and the conference session 2 with Professor Faridah. And the 6th or in the last program is closing. Well, ladies and gentlemen, let's begin our program by saying Basmalah together. Bismillahirrahmanirrahim. Okay, the second program we will have and also the Indonesian national anthem and March of STIKES Rajekwesi Bojonegoro. Please.
Rajekwesi Bojonegoro mengabdikan ilmu untuk berdiri untuk berprestasi wujudkan masa depan, ciptakan tenaga kesehatan, berdedikasi dilakukan inovasi dan tingkatkan profesi. Semangat maju tekad patria, kobarkan di dalam dada. Jaya alma mater tercinta, berkibar dan sentosa untuk selama-lamanya, untuk selama-lamanya. Mengabdikan ilmu untuk berdiri, untuk berprestasi wujudkan masa depan, ciptakan tenaga kesehatan, berdedikasi dilakukan inovasi dan tingkatkan profesi. Semangat maju tekad patria, kobarkan di dalam dada. Jaya alma mater tercinta, berkibar dan sentosa untuk selama-lamanya, untuk selama-lamanya.
STIKES Rajekwesi Bojonegoro.
Okay, thank you very much. The next program will be opening by Chief of STIKES Rajekwesi Bojonegoro and brief presentation about our theme today, trend and issue of global health in community area. To Mrs. Rahmawati, time for you, please.
Thank you, Mr. Ari. Good morning, ladies and gentlemen, fellow speakers, and the audience. Welcome to STIKES Rajekwesi Bojonegoro, Bojonegoro District, East Java, Indonesia. First of all, I would like to thank the outstanding speakers, the Honorable Mr. Professor Bisma Murty from University, Indonesia, and Professor Faridah Musaid from Lincoln University College, Malaysia. Second, I would like to thank the audience who attending this event and supporting us. I also convey the greetings for our beloved Chairman of STIKES Rajekwesi Bojonegoro, Mrs. Fitrotin Aziza, that she cannot attending this event because she's on her pilgrimage. Ladies and gentlemen, this health seminar international is the first time we are holding on to commemorate the Natalies of STIKES Rajekwesi 28. In this opportunity, I will share you about our general theme about threat and issues of global health. Mr. Ari, can you see my presentation?
Yes, yes, please. It's clear. Please continue.
Okay. Yeah. We often hear about global health. So, what is global health? Global health is collaborative research and effort between countries to promote health for all people in all countries in the world by promoting health, eliminating disease, disability, and avoidable death. According to this term, it can conclude that global health is collaboration of countries in the world based on evidence-based research by using various breakthroughs to improve public health with environmental, economic, political, and social determinant resources to achieve SDGs 2030 health for all and all for all. There are so many global health issues, such as the climate crisis, inequity on healthcare, healthcare in disaster area, access to healthcare, infectious disease, non-communicable disease, pandemic, unsafe product, health human resources, youth safety, technological advancement, nutrition, maternal and child health, and sanitation. And this in an opportunity, I will share you several of global health issues. The first is the climate crisis. Since a long time, we face a serious problem about emission from transportation, industries, factories, and those are make bad air quality due to emission. And bad air quality causes both disease and environmental damage, like a lung disease, cancer, global warming, flood, and drought. Drought itself causes lacking of food supplies. Inequity on healthcare. Differences in the economic level of different countries lead to inequity in the distribution of healthcare. According to World Health Organization, that to address equity in healthcare are by improving maternal and child health, nutrition, mental health, gender equality, adequate sanitation, and guidance on how countries can improve healthcare equity. Healthcare in disaster area. Conflict conditions force large migration flows which affected the lack of access to healthcare. Infectious disease. There are so many factors due to infectious disease, such as weak health system, lack of health financing, bad sanitation, LGBT, and those are causes of deadly disease, such as HIV/AIDS, dengue fever, hepatitis, and etc. Non-communicable disease. Talking about non-communicable disease, it's more about behavior. Demographic changes, poor diet, obesity, poverty, migration, tobacco, and the risk factors of death due to non-communicable disease, such as heart disease, cancer, diabetes mellitus, and those diseases which are actually preventable. Youth safety. Every year, more than 1 million teenagers die from road injuries, HIV AIDS, respiratory infections, interpersonal violence, suicide. The data also shows an increase in the consumption of alcohol, illegal drugs, free sex, and lack of physical activity. Maternal and child health. The high maternal mortality rate, where 75% of maternal deaths are caused by postpartum hemorrhagic and preeclampsia, which should actually be prevented. Complication of pregnancy and childbirth cause adverse effect on children's health for low birth weight and child mortality. Sanitation, war, migration, climate change, and environmental damage causes bad water quality and inadequate environmental sanitation, which influence community health. Nutrition. Nowadays, we have a serious nutrition problem that is double burden. Double burden is opposite condition, that is malnutrition and obesity. Increasing our purchasing power changes the food pattern by consuming high fat and protein. On the other side, poverty, lack of healthy food access, and high consumption of carbohydrate to condition make the double burden, such as stunting, malnutrition, and obesity. So, why community? What is the role of community? Global health trends and issues that is developing is strongly influenced by behavior, environment, and social determinants. Community empowerment efforts by providing education and healthy life skill by promoting health, namely the process of empowering communities to increase control and improve their own health, not only individual behavior, but also development social and environmental intervention to achieve the agenda SDGs 2030, health for all and all for health. This is my brief presentation, and then we will listen to further presentation for our experts, our expert speakers about key issues shaping global healthcare by Propisma and how to deal community stunting based from Professor Parida. Thank you for joining with us, and we apologize for any shortcoming in organizing this event. Thank you. I send back to Mr. Ari. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you for Mrs. Ramawati. We have understood why we do this program, that global health trend strongly influence our behavior and also the environment. That's why STIKES Rajekwesi Bojonegoro, today we have the first conference, with the first international conference by taking this topic. Well, ladies and gentlemen, after we have the opening of the session, now we will have the main program on the main agenda for today is our conference with wonderful speakers, Professor Bisma and Professor Farida. And this program will be hosted by Mrs. Eva Riantika. Hello, Mrs. Eva.
Yes, hello, Mr. A.
Yeah, okay. How are you today?
Very good. I hope
Okay.
that is that.
Yep, very good. And we are waiting for you to be the moderator of today. Are you ready, Mrs. Eva?
Yes, inshallah. I ready.
Yeah. Okay. Well, ladies and gentlemen, for the next session will be presentation and also discussion will be hosted or moderator by Mrs. Eva Riantika. To Mrs. Eva Riantika, time for you, please.
Yes, thank you. Well, thank you very much, Mr. Ari, for inviting me here. So once again, I say good morning to ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh.
Yeah.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning.
Once again, I say welcome to our first international conference My name is Eva Riantika. I'm come from STIKES Rajekwesi, Bojonegoro, and I'm going to be a moderator today. And ladies and gentlemen, I'm very pleased to see you via Zoom meeting. So before we start our presentation and discussion, let's remind again that start from 2020 was year revisiting year of global health focused by COVID-19. And global health, as our theme here, focuses on the health needs of people around the world. And ladies and gentlemen, World Health Organizations was reported the top 6 of global health trends and issues are such as non-communicable disease, infectious disease, food supplies, environment factors, inequality, and healthcare in the war zones. So, as a health worker, how to shaping future global healthcare and what is the role of community empowerment? So, welcome to the international conference titled Trend and Issues of Global Health in Community Area. And ladies and gentlemen, our institutions as the oldest health institution in Bojonegoro Regency, East Java, Indonesia, wanted to give the positive contribution to this problem. And so through this seminar or conference, we have two speakers who have already joined in with us. And we have Professor Bisma Murti, Doctor, Master Science, Master Public Health PhD, and Professor Dr. Faridah Moh Said. And the first time, I'd like to greet Professor Bisma first. Hello, good morning, Professor Bisma.
Hello, good morning.
How are you, Professor Bisma?
Very good. Thank you.
Good. Okay. Thank you for joining with us today. Welcome to this event, Professor Bisma. Thank you. And the next, I want to greet Professor Farida. Hello, Professor Farida. Are you with me?
Yes, thank you so much.
Yes.
And
Welcome.
yeah, well, thank you very much.
Yes. Thank you very much for following us here. Welcome to Indonesia, although it is only on Zoom.
Yes, thank you. Welcome to Indonesia by virtual.
Yeah, yes. Thank
Yes,
you.
in virtual meeting.
Yes, by virtual meeting. Great. Welcome, Professor Farida. Welcome to the show. So, ladies and gentlemen, I have made sure that both of speaker has been joining with us. So before we start our presentation, let me to inform you that we are going to do the presentations to the next till 3 hours that have been divided into 2 sessions. And every session and each speaker will talk around 60 minutes. And then after the speaker have been presented their topics, we will move to the next session, the discussion session that we have 30 minutes in the discussion. So to the audience and participant can ask the question during the discussion sessions by raising your hands into the Zoom meeting or typing your question into the chat room, and I will read them for you, of course. So I think that's all of my explanations before the start of the meeting. So let's be moved to the first sessions. In the first sessions, we have Professor Bisma, and I'm going to invite Professor Bisma to joining with us with the title Key Issues Shaping Future Global Healthcare. And before Professor Bisma start his presentation, let me to read the curriculum vitae first. So, ladies and gentlemen, this is the curriculum vitae from Professor Bisma Murti. Professor Bisma Murti is a lecturer and headmaster of public health study program in Universitas 11 Maret, Surakarta, Indonesia. And Professor Bisma also active in the international journal publishing, such as Journal of Epidemiology and Public Health, Journal of Health Promotion and Behavior, Journal of Maternal and Child Health, and Journal of Health Policy and Management, Indonesian Journal of Medicine, and Journal Pengabdian Komunitas. And he also active at the International Conference on Public Health. And there are educational background from Professor Bisma. Professor Bisma has been finished his senior high school in SMA Katolik Loyola Semarang. Then he continued her bachelor study as a doctor in Universitas Airlangga, Surabaya. and then continue his Master Public Health in Epidemiology and Biostatistics to Land School of Public Health and Tropical Medicine, USA. Also, Master of Science in Health Economic University of York, UK. And the latest study of his is Doctor of Philosophy in Health Economics, University of Newcastle, Australia. Wow, that's such an amazing journey from Professor Bisma, and I think it can motivating us as the participants here. So that's all the explanation from the curriculum vitae. Professor Bisma, you have 60 minutes to present your work. So to Professor Bisma, please welcome.
Yeah, thank you, Eva. Thank you for reading my CV, introducing me. First of all, I would like to say thank you to the director of STIKES, Rajekwesi, Bojonegoro, for inviting me as one of the speakers in this prestigious and the first health international seminar. And also, I would like to give appreciation to the organizing committee, which have prepared this event adequately well. As I can see on my display on my computer, there are about 100 participants attending this event. About 300, many people attending this event. And I have an hour talk also with the topic already written in my material. Let me show the material, my slides. Eva, can you see my slides fully in full screen?
Yes, Professor Bisma, very clear.
Yes. Yes, this is written according to the theme of the seminar. The themes reads like this: trends and issues of global health in community areas. And my topic is rather different because I will talk global health care rather than global health. It's slightly different healthcare. So my focus is on anticipating or on giving you an overview about the key issues shaping future global healthcare about 2 decades from now, according to my slides. And this is my CV as have been described by Eva. I just want to add that everybody attending this conference or seminar, if you have a good paper on epidemiology, on public health, promotion and behavior, maternal and child health, health policy and management, as well as in medicine, please feel free to send to us to be published in this journal. I publish 5 plus 1, 6 plus 1, so altogether 6 journals. And the last journal is very new. The name of the journal is Jurnal Pengabdian Komunitas. So if you have paper, manuscripts, feel free to submit, feel free to send to us to be published. All of these journals, except the number 6, have been indexed in SINTA by the Ministry of Higher Education. And this was my past education from my high school to my PhD. As mentioned by Eva, I got my medical degree from Rangka University in Surabaya, and then I went abroad to the USA to study epidemiology and biostatistics at Tulane School of Public Health and Tropical Medicine. And the campus looked like on the top right of this slide. Then I earned another Master of Science and Health Economics in York, a city in the United Kingdom. And then finally, I went to Australia to get my PhD, also in health economics at the University of Newcastle. So I will talk and I will give you an overview what it will look like about the healthcare system 20 years from now. So this is summary of future health. By the year 2040, only 20 years from now, healthcare as we know it today will no longer exist. There will be a fundamental shift from healthcare to health. So the focus in health rather than healthcare. Disease may never be completely eliminated. However, through science, data, technology, we will be able to identify it earlier. We can intervene proactively and better understand disease progression to help consumers more effectively and actively maintain their health and well-being. So the future will be focused on wellness and managed by companies that assumes new roles to drive value in the transformed health ecosystem. This is the situation that we will anticipate on the coming 2 decades. And in the future healthcare system, the center is the humans, the consumer. And there is a great possibility for the rise of preventive care and well-being. The preventive care will become more important than today. As you all realize today, healthcare is on the brink of large-scale disruption. COVID-19 has revealed how vulnerable the healthcare industry is to change, and it needs for technological and structural transformation. In the future of health, we anticipate 6 key areas. First is data sharing. Second, interoperability. Third, equitable access. Fourth, empower consumers. Fifth, behavior change. And sixth, scientific breakthrough, which altogether collectively will transform the existing healthcare system from treatment-based reactionary care to prevention and well-being. In other words, from curative paradigm to the preventive promotive paradigm. Care facilities and health communities, both virtual and physical, will provide consumer-centric delivery of products, care, wellness, and Advancements in technology have changed the way consumers manage their own healthcare and interact with medical providers. Consumer will track or manage their health using a mobile app. Specialized delivery facilities are on the rise. So we will predict that the role of general hospital in future will diminish. Rather, we will see specialized hospital. Specialized care delivery facilities are on the rise, and new technology trends are making healthcare more personalized than ever. So the emphasis on personalized care. Consumer-centric health players will provide virtual, personalized wellness and care to consumers, leverage community to encourage behavior change, and drive consumer and caregiver education. And the second is interoperability. Hospitals today typically have in excess of 100 information technology systems that need to communicate with each other. By interoperability, we mean the ability of different information technology systems and software applications to communicate, exchange data, and use the information that have been exchanged. Interoperability permits data to be shared across clinicians, laboratories, hospitals, pharmacies, and patients, regardless of the application or application vendor. And next is about data sharing and real-time visualization. Healthcare organizations move toward sharing more data with each other. As such, the collection and the creation of large data sets will increase accuracy and better predict to spot trends. They call it big data. Healthcare administrations must keep up with ever-evolving technologies to prepare organizations to move toward real-time data visualization to meet patients' demand. Administrators must collaborate with doctors, technicians, medical centers, IT teams, and government bodies to facilitate the implementation of this advanced technology. And consequently, the future of healthcare services will demand professionals to integrate traditional skills in care, communication, and leadership with new digital skills in technology and analytics. These new skills will work in tandem with the adoption of the trends and advancements in healthcare system. Self-care. Self-care is the practice of taking an active role in protecting one's own well-being and happiness. Self-care enables people to manage their health and well-being. Self-care has great potential to improve health outcomes for people and support savings from stretched healthcare budgets. Stakeholders will likely commit to building an environment where patients are empowered and engaged. As already mentioned before, the future healthcare is more personalized. So it's called personalized medicine care, medical care. In contrast to this one-size-fits-all approach, the future personalized medical care, also known as precision medicine, takes into account an individual's gene, environment, lifestyles to identify personalized disease treatments and prevention strategies. For example, best known for its uses in oncology, such as tracking the genetic profile of patients' tumor cell to identify most effective forms of treatment. Precision medicine is also impacting pharmaceutical research and healthcare technology. And in this picture, I give an example of personalized medical care in terms of gene therapy. As you can see, the first picture describes about the cells with non-functioning gene, and then by adding DNA containing a functional version of the lost gene. Then on the third picture, as you can see, cell functioning normally. This is an example of gene therapy for cancer. And this is an example of personalized medical care. And this one is very important, the critical role of biosensor. What is biosensor? A biosensor is an analytical device which uses a living organism or biological molecules such as DNA, enzymes, antibodies to detect the presence of an analyte, also called biomarker. The analyte or biomarker may be virus, bacteria, or blood glucose. And biological molecule, this is called bioreceptor, including antibody, enzyme, DNA, protein, and cell. And this will generate biological signals, and biological signals will be translated, will be converted to electrical signals and also optical signals by a device or by a function named transducer. And finally, these electric signals will further process and condition to give signal display, which can be displayed in a mobile application. And this slide tells about biosensor. And biosensor, everybody can wear biosensor, so it's called wearable biosensor. Wearable biosensors provide continuous real-time physiological information via dynamic non-invasive measurement of biochemical markers in biofluids. And this is on the right side picture, examples of biofluids, including sweat, tears, saliva, and interstitial fluid. Accurate and reliable real-time sensing of physiological information using wearable biosensor technologies would have a broad impact on sustaining an individual's health and wellness. On the picture, you can see the biosensor can get the analyte or the biomarker from saliva, sweat, from urine, seminal fluids, from tear, stool, cerebrospinal fluid, as well as from breath. And this is a schematic representation of biosensor. A biosensor is a device comprising a series of components that include analyte, bioreceptor, transducer, electronic, and display. Yeah, as we can see before, the starting point is analyte. Analyte, for example, glucose, antigen, will be recognized by bioreceptor, including DNA, enzyme, or antibodies, to generate biological signals. Biological signals will be translated or converted to optical or electric signals by transducer. Transducer is basically a converter, also known as signalization. This process is known as signalization. And by electronic device, this optical electric signals will be converted to the digital form. And using the combination of hardware and software, these signals will be displayed in numeric, graphical, tabular, or image display like this. The biosensor can be applied to disease detection. It's a powerful tool for early stage disease detection and treatment in clinical setting. For example, biosensor can monitor real-time biological signals, such as the release of protein or antibodies in response to tissue damage, muscular dystrophy, cardiac infarction, as well as inflammatory events or infection. And on the picture on the left side, you can see that Alzheimer's disease can be detected by this biosensor using DNA. Using biosensor DNA, and then this information or this signal will ultimately allow doctors to diagnose Alzheimer's disease. And the nice things, another nice things of biosensor, it's possible to monitor health continuously because it's always on sensor. Technological advances will likely define how care is delivered. For example, today an acute myocardial infarction would likely require hospitalization. But in the future, this event could be prevented altogether through the use of always-on sensors and continuous in-home monitoring. So this illustrates about the importance of prevention. In the future, the emphasis is on the strength of the future healthcare is on the prevention. Wearable biosensors can also be used to support personalized preventive care, not just curative care as before, but also preventive care. With the support of biosensors, allow patients to make lifestyle choices to stay healthy and track and keep up their physical well-being. So the future of healthcare technology gains more patient-centered focus. Healthcare professionals will utilize existing technologies like wearables to collect consumer health data and analyze in a way that patients can understand and leverage with ease. Biosensor can be used also, can be applied to tissue engineering and to regenerate tissue in the regenerative medicine. Biosensors can be used to engineer tissue constructs for restoring the lost functions of disease or damaged tissues and organs. On the right side, I have given an illustration of regenerative medicine treatment, including stem cell therapy, platelet-rich plasma, lipogens, and prolotherapy. As I mentioned before, there will be an increasing importance of specialized outpatient care centers. Patients who do need care will likely receive it in highly specialized settings that are tailored to service a specific need rather than a one-stop for all disease states and specialties. These procedures are offered at ambulatory medical or surgery centers, such as outpatient surgeries, cataract removal, and colonoscopy. We can expect that the role of general health. Telehealth. Telehealth is the ability to engage in healthcare quickly and seamlessly through technology like smartphones, laptops, and streaming services, marks a significant shift in the modern world of healthcare. Accessibility is improved as those who do not live near a healthcare facility can benefit from telehealth to connect with the healthcare professional more regularly. Those who require treatment for certain disorder, such as mental health disorder, can engage in treatment from the comfort of their home via video chat. Then, localized health hub. While there will be some specialty care, healthcare will likely be delivered in localized health hubs. Localized health hubs will serve as centers for education, prevention, and treatment in a retail setting. Additionally, local hub will connect consumers to virtual home and auxiliary wellness provider. And then what about health financing? There is very likely the health financing will move to individualized health financing. Unlike the health insurance of today, these organizations will create the financial product that individual will use to navigate their care. These organizations will offer tailored modular and catastrophic care coverage packages. They will drive reduction in care costs by leveraging or exploited advanced risk model, consumer incentive, and market power. So this is emphasizing the importance of individualized health financing. And I think this final slides also in paying clinician, in paying healthcare professional, there will be a method named value-based care financing methods will be adopted to pay healthcare professionals. Providing a stellar patient experience is top priority in healthcare industry. And many providers will shift their focus from value-based healthcare to from volume-based healthcare to value-based healthcare. From value-based, for example, fee-for-service to value-based healthcare. Instead of following a traditional fee-for-service model, value-based healthcare financing reward providers by determining the cost of the service as it relates to the quality of care, patient outcomes, and other factors. So this new payment methods not only will benefit to patients, but also will benefit to providers, payers, suppliers, and society as a whole. This is the real last slides. What about government? Does the government assume some role? Yeah, the answer is yes. The government remain to assume some role, but we probably won't view them as government traffic cops. They will set the standards for how business is transacted. The regulators of the future will influence policy to catalyze the future of health and drive innovation while promoting consumer and public safety. Yeah, that's all what I want to present. Thank you. I give back my time to Eva.
Yes, Professor Bisma, thank you very much for having the presentation about STIMinute with a wonderful and very informative presentation for us actually. So, well, ladies and gentlemen, after the presentation from Professor Bisma, now we move to the discussion sessions. So as I informed you before, we have 30 minutes in the discussion sessions. So please, if you have any question, please raise your hand and then unmute your speaker, turn on your camera and raise hand using the feature on the Zoom mode. Or type your question, please, at the room chat, please. Okay, Professor Bisma, I got the first questions from Mrs. Inani Wildania that has been texted on the chat room. Okay, give me a minute. The first question from Mrs. Inani, can telehealth be able to eliminate or reduce of effectiveness of interpersonal communication relations or therapeutic communication built between doctor and patients in expressing the symptoms of the disease they feel as in face-to-face health consultations? Thank you. That's the question to Professor Bisma. Is that clear enough?
Yes, yeah. Yes,
okay.
It can. The answer is it. Not it can reduce, but it can replace. The virtual communication can replace the in-person communication in terms of consultation and also therapeutic procedure. As I mentioned before, there is an increasing tendency of self-care with guidance from the clinicians via mobile application, via computer. So, for example, if the patient had to take medicine for a long time, in the beginning, the patients must be present at the clinic in person, have consultation, and together with the clinician or with the doctor, will make it clear about the treatment planning. But for the subsequent visits, it can virtually, not necessarily by in person.
Okay, thank you very much, Professor Bisma, for answering Mrs. Inani question. So telemedicine is not reduced, but replace to make more effectively, to make the communication between the patients and the doctor. So maybe we can use the telemedicine, yes, Professor, by texting or by the mobile phone applications to make the health consultation or ask questions, something that maybe a disease or something wrong the patient feeling, so the patient do not need to go to the hospital first. Maybe like that, yes, Professor Bisma. So I hope it can answering the to Mrs. Inani questions. Yes. Okay, move to the second question, Prof. We have the question from the students. This is our Bachelor of Nursing students. Okay, Assalamualaikum warahmatullahi wabarakatuh. Let me introduce myself. My full name is Nurul Eka Yoga Miftahul. My nickname Miftah, and from the Bachelor of Nursing Study Program STIKES Rajekwesi Bojonegoro, and I want to ask Professor Bisma. And the question is, what are the basic things that must be considered in order to maintain the health of our mental health and behavior? That's the questions to Professor Bisma.
Yeah. Yeah, our health is as. Let me show again. Let me share again my slides.
Okay, please, Professor Bisma.
This question relates to the future orientation of healthcare system. The goal is to the goal or the objective is everybody's objective is to attain health rather than healthcare. So this is in line with the Grossman's model in the 70s. He says that what actually people want is health rather than healthcare. So the demand for health is the actual demand, and the demand for healthcare is the derived demand of health. Again, what actually people want is health, not healthcare. And then health, as I give illustration here, consists of 5 dimensions: physical, not only physical, but also social, spiritual, mental, and emotional. This means that many factors influencing health, because health is multidimensional. Because there are many factors, so there are many professionals, not only in the area of health, who will have an important effect on people's health. Yeah, not only doctor, but also other healthcare professionals, as well as non-healthcare but related to health. For example, psychologists, sociologists, also religious leader, they all will determine health, especially mental health. Yeah, that's my my answer to the last question.
Okay, thank you very much, Professor Bisma, for answering the students' question. Yes, so everybody also doesn't need healthcare, but also they need health. So to start it to get the health, so we should have the health from physical, and then social, emotional, spiritual, and mental health firstly, I think. I hope it can answer the student questions. And so next we move to the third question, Professor Bisma. There is the questions from unknown. Yeah. Okay. The question is, as we know, in Indonesia, there is any kind of society with different culture, education, economic, but the future health is based on digital. So how about the role of community based in healthcare? Thank you. That's the question to Professor Bisma.
Again, which question? From whom?
From the lecturers, STIKES Rajekwesi Bojonegoro, Prof. Bisma.
What's his name or her name?
Okay, the name is Mrs. Evita. And she texts me from our phone.
Okay, it's
Yeah.
not in the.
Yeah,
it's-
not on the chat room. Yes.
Can you repeat again, please?
Okay, I will repeat. The question is, as we know, in Indonesia, there is any kinds of society with different culture, education, economic, but the future health is based on digital. So how about the role of community based in healthcare? The role of community in healthcare.
Yeah, the way how information will be distributed and will be provided will be affected by individual, we call it consumers, as well as a group of consumer named community. So because companies will have to sell, for example, sensors, and then in order to increase sale of biosensors, they have to conform. They have to make the biosensors suitable for the specific communities. So this again emphasizes the importance of consumers and the group of consumers, namely community, in the healthcare delivery as well as the healthcare products. Yeah, that's my.
Is Eva to mute? Still mute, is Eva.
Okay, I'm sorry. Okay, thank you very much, Professor Bisma, for answering the Mrs. Evita questions. I hope it can answering her. So, ladies and gentlemen, we still have 10 minutes left in the session of the discussion. So, please, if you have any question. Oh, okay. I got once again the fourth question from Mrs. Nina to Professor Bisma. Mrs. Nina is the chief of blood bank technology study program, STIKES Rajekwesi Bojonegoro. And the question is, as a healthcare professional, there is also some challenge for introducing the personal preventive care by using telehealth. How we can reach all people and make they able to access the technology, while some of them still ignore the development technology or they cannot purchase it because the poverty. So that's the question to Professor Bisma, please.
Yeah, in providing healthcare, we can make an analogy of selling other commercial products. For example, in the beginning, the distribution of mobile phones or smartphones were very limited. Only rich people can buy mobile phone or smartphone. But eventually, the price will gradually decrease, and more people, including with limited budget, can buy smartphone. Likewise, in healthcare, in the beginning, maybe it looks expensive but with time evolving, the price of the mobile apps gradually will decrease. So these applications will be offerable to most people. I think this is situations like that in future.
Okay, thank you, Professor Bisma, for answering. So we can make the conclusion that we can spread the telemedicine and the upgrading of the high technology in healthcare. It's not a difficult way from now because everyone we think can purchase or buy the mobile phone because of the price maybe over year and year is always decreasing like that. So this is the strategy. I hope it can answering the Mrs. Nina questions. So we still have 5 minutes left. Okay, enough?
From Tasikmalaya, Miss Eva, in the chat room.
Okay. Wait. I'll check first. Oh, yes. The last questions maybe, yeah, ladies and gentlemen. This is the last question from Mr. or Mrs. Miftah, yeah, from Universitas Muhammadiyah Tasikmalaya. I want to ask to Professor Bisma about telehealth. I do agree with Professor about telehealth, but how we can apply telehealth in a rural area in Indonesia? That's the question, Professor, please.
Yeah, the answer is how can we? Yeah, it depends on the telecommunication infrastructure to build, and this will also gradually will develop better from time to time. For example, if you can have an example of access of again mobile phone. Yeah, in the beginning, only people living in urban areas can purchase and can have mobile phones, and including the information given through mobile phones. But gradually, people in the remote areas can also benefit from the telehealth. Yeah. Eva, that's my answer.
Yes, thank you very much, Professor Bisma Murty, for answering these questions. I think the question is rather the same with the question from the Miss Nina. Yes, so I think this is the end of the discussion sessions to ladies and gentlemen and Professor Bisma. Okay, and before we move to the next sessions, let me to give the conclusion from this very attractive and amazing discussion with Professor Bisma. Okay, that the conclusion that the future will be focused on wellness and managed by companies that assume new roles to drive value in the transformed health ecosystem. And consumer or the patients will track or manage their health using mobile apps. So we need hundreds and also upgrade maybe about an IT system so that it can interoperability need to communicate with each other. It's not only between patient and health worker, but also to the community and the health worker. So ladies and gentlemen, this is the end of the session 1. Before we move to the next sessions, let me to invite the Vice Chief 2 of STIKES Rajekwesi Bojonegoro, Mr. Ahmad Maftukin MKes, to give the certificate to Professor Bisma Murty. And to Mr. Ahmad Maftukin, please welcome, and I will share the certificate on the screen.
Thanks, Ms. Eva. The Honorable Prof. Bisma Murty, thank you very much for the knowledge that has been given. It is extraordinary and very useful for development the competence of workers. We hope that the future Prof. Bisma will be pleased to share his knowledge with all of us. Thank you very much. Success, Prof. Bisma.
Thank you.
Well, then to Professor Bisma and to Mr. Ahmad Matukin, and also in the audience, please turn on camera because we will take the documentations to this, and I can count it to please take a position, maybe the best position. Okay, I will give you some times. Okay, all of you, are you ready? I will count on 3, 2, 1, and cheese.
Yeah, thank you, Eva.
Okay, thank you very much. Thank you very much, Professor Bisma. Thank you very much for Mr. Ahmad Maftukin MKes. So, ladies and gentlemen, this is the end of the session 1 with the wonderful topic and discussion with Professor Bisma Murty. So, thank you very much once again, Professor Bisma, for joining with us. So we hope we can meet again in real time and very soon in other attractive and wonderful topic with us with STIKES Rajekwesi Bojonegoro. Thank you very much, Professor Bisma.
Thank you, Prof. Bisma.
Okay, ladies and gentlemen, are you ready to move to the next sessions? Hello, are you still with me?
Yes, I'm ready.
Yes, please.
Okay.
Yes, Miss Eva, continue.
Okay, we still have many spirits, yes, to following the next sessions. Actually, absolutely, with a very wonderful topics the next sessions. So let me to move to the second sessions, and I'm going to invite Professor Farida for joining with us. Hello, Professor Farida.
Halo, Assalamualaikum warahmatullahi and selamat siang ya. Kembali.
Waalaikumsalam. Selamat siang.
Waalaikumsalam warahmatullahi wabarakatuh. Selamat siang, Prof. Farida. Okay, Prof. Farida, maybe before you start your presentation, let me to present your curriculum vitae. Yes.
Yeah.
Yes. Excuse me, I want to share. Okay, I need a moment. Okay, and this one.
Maybe you can use the brief one, the short one.
Okay.
Yeah, the short one.
Okay, the short one.
Yes.
Okay, wait, I will schedule speaker profile and signature. Yes.
Yes, please.
Okay. Wait 2 minutes. Speaker profile and signature. Okay. Is that clear enough?
Yes.
For the presentations, or maybe I can make the bigger. Okay. This is the resume of the Professor Faridah Moh Said profile. Professor Dr. Faridah Moh Said RN, midwifery, PHN, MSPH, PhD, as the postgraduate nursing studies and research at the Faculty of Nursing, Lincoln University College, Kuala Lumpur. And Professor Dr. Faridah Moh Said has many years working experiences in the area of clinical nursing practitioners, academic, as well as in management throughout her career in both public and private organizations, national and also internationally. And her experiences included of appointed as clinical nursing director in Madinah, Kingdom, Saudi Arabia, head of nursing postgraduate and research in Lincoln University College, and head of nursing program in University Putra Malaysia. Actively also involved with international mobilization academically and upskill program. She has supervised many PhD students and publications, and her research interests includes of community and public health, Nursing Education and Quality Improvement Program, or QIP. And her current research interest focused on patient-smart e-health education and QIP. And she was also awarded Excellent Outstanding Quality Patient Safety Awards in Madinah. At the last, she received 4 RMC research grant while in UPM and was awarded Erasmus Mundus Scholarship to Portugal. Wow, very amazing journey and experiences from Professor Farida, I think. And it can be inspiring to all of the audience here. So to Professor Farida, you also have 60 minutes to present your paper. And to Professor Farida, please welcome joining with us.
Can I share my, can I share?
Okay,
All right.
please.
Right. All right. Can I start? Yes. Okay. Assalamualaikum warahmatullahi wabarakatuh and good morning to everyone. First of all, I would like to thank to the STIK, Sekolah Tinggi Ilmu Kesihatan Rajekwesi. Am I right? My pronunciation? Bojonegoro. Yeah,
Bojonegoro.
Bojonegoro. No, the pronunciation is and I would like to thank the chief of the School of Sekolah Tinggi Ilmu Kesihatan, Madam Fitrotin
Aziza.
Yeah, Protein and Puan Rahmawati and all the committee, and thank you for inviting me. I think congratulations for the first very successful and very inspiring conference that you all organized. And this is a very successful in terms of you have more than 300 participants. Congratulations. All right. So I was given this this topic. This is a very hot topic in Indonesia, especially. This is the current issue in stunting management and the community empowerment. So I add a bit of this word, turning challenges into opportunities. So I always on the positive side. So whatever challenges that we have, so we have to make it as our opportunity so that we can move on and can achieve our outcome. All right. Okay. Okay, this is my outline. So we're going to discuss a bit on the stunting, the definition and categories, the prevalence, determinants, and the consequence of stunting. And we're also going to explore what are the multi-sectoral empowerment approach of stunting program. And we're going to end with our conclusion. All right. So izinkan saya dalam bahasa Inggeris dan juga in some of the parts I will use bahasa Indonesia, bukan bahasa Malaysia. So I can use both bahasa Indonesia and bahasa Malaysia. So all right. So to start with, our this is what you call that the global goal objective. So everybody knows about the global goals which they want to improve and sustain the development of all the countries. So they have about 17 sustainable development goals, and the first to number 6 are more related to the health of the humankind. Right? So they want to reduce the number of poverty, which has some relationship with number 2, that is 0 hunger. So if there is no poverty, there will be no hunger. When you have no hunger, that means that you are going to have a good health and well-being. Am I right? And with that, you're going to have good education, given any gender equalities, you know your rights, and also accessible to the clean water and sanitation. So this is all those 6 main important areas which is related with the stunting. Okay, since stunting is a very, very crucial to overcome, So UNICEF, WHO has created many guidelines to improve on the nutritional status of the children as well as women. So based on that, with that zero hunger, they have created so many frameworks. So the area that they're going to focus more, where according to here, is that nutritional sensitive in terms of the sector synergies, where they have all the six, six domains there. They're going to have health, HIV/AIDS. They're going to improve on the washing, hand washing, or whatever washing. The nutrition has to be improved. The educational has to be improved. Child protection has to be improved, and social inclusion also have to be improved. So this is all related to the sustainable goal number 1 to number 6. So by then, they hope that with all those things, they can have the improvement of the nutrition for the children as well as the women. So if you look at all these, the house here, this is related to the not only about the family, but it's also about the community. In other words, that community have their role in terms of improving on the knowledge. How they're going to improve on the knowledge? They need to have the partnership. The partnership is not by the community itself. They have to get the support from the governors. So in order for them to manage to have that good nutrition. Okay, so with that knowledge and partnership, with the empowerment by the community, then they're going to have a good nutritional status for the maternal and child. All right. So with that, then only it can move to the very good early childhood nutrition, very good nutrition for all those women and adolescents, and they can go to education without any complication. All right. These are all those efforts. We still read a lot of this report by the global data that indicate the rate of chronic malnutrition in young children still high, persistently high, especially in low-income countries. Yeah? So like in this graph, this shows that. So it is among the low to middle income countries, especially in low income countries, which a condition that is strongly linked to the poverty. Remember, we said we want to remove poverty in the community. And malnutrition is majority being recognized through the standard measurement, or there is a standard rules in terms of identify on the malnutrition. You know, they use that the height for age or the Z-score or whatever they have, that the standard deviation. So they have a certain criteria to identify this stunting condition among the children. All right, so we're going to discuss on that, you know, the height for age and all those criteria for the stunting. So based on the data as in the reference here, we can see that, you know, even though most of the countries, especially in the middle to developed countries, they have a different type of problems. So now our focus is all on the malnutrition, which is very high in the, if you look at in this graph, mostly high in the South Asia. So this is where we can see which countries are included in the South Asia. All right. So as I mentioned earlier on, certain middle income country, they are facing some problem in terms of, we call it a triple burden of the malnutrition. Some Asian countries, they are reporting of double burden, as one earlier on was mentioned. So they have that stunting as well as overweight. In Indonesia, they have a trouble burden. Not the triple burden, but it's a trouble burden because there is an increase on stunting as well as overweight, as well as wasting. All right. And in Thailand, they have a lot of wasting, and they also have the increased number of overweight. You see, you can see the increase in the percentage, 5 to 7 in wasting, and overweight is 8 to 11. So if you can see that overweight is increasing so drastically, all right? So this is some of those countries that shows where the malnutrition with the double burden. So I'm not going to discuss more on that. So this is just for sharing. So you can see that the other side is on overweight. And if you look at on the other side is on my right side is on stunting. So if you can see in on that overweight, Indonesia also having the same problem, and in the on the stunting, you have also look at the number of stunting compared with the Asian countries. Right? So just a brief definition of stunting. So it can be simplified in terms of there is some impact in growth and development of children under 5 who experience from the poor nutrition, repeated infection, and inadequate psychosocial stimulation. So you can say that this issue stunting is not only because of the nutrition. So we have to look at all those other factors why stuntings happen. All right. So we, in other words, we can say that when you are trying to overcome stunting, don't just look at the nutrition only, because it's not only impact on the physical status, because it is also affecting the brain power of the stunting children. And you know, as we know that 100 days of critical is the critical brain development for the children. And child growth chart is the indicator scale to determine stunting, as I mentioned earlier on, right? Okay, this is a very important point for me to take your attention. So according to WHO, we have 2 level of stunting. They have a moderate and a severe. And where it is very important for us to identify in terms of the moderate and who are the children in terms of having severe stunting. Why? Because this is what we call important markers for the early warning sign. So we don't want to have one definition, one fit all for definition, which says stunting. When they come, they already have below 3 standard deviation. Right? So when they have in a severe stunted, when they come to you for any improvement, you can improve, but it takes longer for the improvement compared to those who are moderate stunting. All right, so it is very important to identify these 2 categories. All right. So I think if you look at here, we have all those stunting data, which is all high. But let us look at the positive side of this data from stunting. So if you look at even though it is high, basically there is some improvement of stunting in Indonesia, because you can see it have already reduced. But what happened is that why it is considered still high, because you have not met the global targeted what do you call that numbers. So that is the reason why it is high. But what I can say, congratulations, it's already done. You can see a lot of improvement done by the Indonesian government. Okay, even though you are ranked still high, but there is some improvement. So a good job for all this. Okay, again, we are talking about the multi-factors causes of stunting. So as I mentioned earlier on, when you want to intervene on the stunting, so we have to look at all the multiple factors here. So they have from the child, from the household, as well as from the community. I think everybody knows on this, what are the factors here, all right? So I'm not going to go in depth with that, all right? Okay. So because stunting is a very, very crucial issues, I think a lot of this program by the Indonesian government to improve on stunting. So they already converted that multifactors, the global multifactors of stunting into in the context of Indonesia. So which you can get it from many what do you call that, journals. It has been published. All right. So looking at all those factors, but now our concern is why we need to prevent this stunting, because we want to prevent the outcome or the consequences of that stunting. So if you look at all those all those stunting can lead to, so a lot of focus. They are impact cognition. I think everybody knows that they have slow, long bone, slowing long bone, muscular atrophy, anemia, and so on. But I would like to focus one additional consequences. So I add in here, for me, it is a very important, it is emotional consequences. See, so when a child being diagnosed as a stunting, so what type of dalam bahasa Indonesia gelarannya dibagi apa? Dia kerdil, alright? So kerdil, bantut, and so on. So here in Malaysia we call it bantut, and in Indonesia they call it kerdil, and so on. So when they are called by that nickname, there's some emotional impact on the children. So this is which can stay longer in the child itself until they grow up. No, when they grow up, they still stay stunting, then they become the victim of bullies. So this is all those interrelated of how this stunting will outcome can be. All right. So that is the reason why it's very important for us to overcome on the stunting. All right. Okay. Studies have shown that there is 8 factors that contribute to the successful translation of policy into stunting prevention program activities. So number 1, you must have not us, I think the government itself must have a well-structured national scaling up nutrition program. So they must have the framework, a very good framework, so which they can translate to all those implementers, right? They should have a reliable coordinating platforms and district ownership. Systematic and evident information program also needed, and multiple forms of data used to inform program planning also needed. So this is where Prof. Bismarck lectures come in, how we need to have all those informatic intelligence to come in, all right? Then we need to have a multiple sectoral implementation approach to stunting prevention, innovation in technology to improve overall program efficiency. So this is where now we can see the need for the technology in terms of improving on the health. Remember, we are talking about patient-centered, and patients are the person who are responsible on their own health. The systematic collaboration among diverse stakeholders, and also a strong public health nutrition capacity of program and the team members. All right. So this, who are those people in what do you call that, public health teams? Okay, let us look into that. All right. So if I'm not mistaken, I checked through all those articles. Indonesia has a very good framework in terms of combating stunting. So they have all those 5 pillars in place, which is very good. That shows that the leaders have to provide their commitment and a clear vision, the crystal clear vision of how to improve on the health status of their community, and national campaign and behavior change communications. So this it is done very aggressively. National, region, and village program convergence, as well as food and nutrition security, monitoring, and evaluation. So they have all those 5 pillars with really a good framework to improve on the stunting. Number 2, the multiple, remember I said, what are the factors that can make the program successful? Multi-sectoral implementation approach to stunting. So if you look at here, you have all those stakeholders are also involved with this stunting program. All right, so it is really in place. So it's very, very good. All right. And they also have a systematic and evidence-informed program design. So they already have that. So it is all in place for everybody to follow. All right. And they also have the systematic collaboration among diverse stakeholders. All right. Oh my God. Sorry, my battery is low. Excuse me.
Yes, please, Professor Farida.
All right. Sorry. Okay, if you can see that there are many stakeholders and who are working together with the government on how to improve the stunting. Strong public health nutrition capacity program and the team members, if you look at that, they have a lot. So that is the reason why I said Indonesians have done a very excellent program to improve on stunting. Right. So if you look at some of these programs, which by other countries who have successfully improved on their stunting, like the Senegal, Thailand, Brazil, Nepal, Vietnam, and Bangladesh, all these from low-income countries. So they are almost the same as other countries, and Indonesians have all those what we call that platform and all those strategies in place equally as same as other countries like I mentioned earlier on. All right. See? So I say Indonesia memiliki sebahagian besar faktor tersebut, baik yang sudah maupun sedang dijalankan. So Indonesia really work according to the strategic plan. All right. So the program is well in place. All right. Okay. So this is some of the program that are already in place, which what we need is to do the strengthening. Now, this is the issue that we're going to discuss. Issues and challenges that we can make it into opportunities and opportunities. Right. So studies have shown that, okay, what makes this stunting program is very challenging or ineffective because of a few areas. One is implementing challenges, gaps in understanding, and additional contextual challenges here. So I just highlight a few of areas which I think very important for us to discuss. The empowerment and participation. So empowerment is very important. So not only the community, but the empowerment of the implementers as well. So we have to empower all those people who is going to provide the service, right? So as what in our early presentation, now everything will be empowered by the patient themselves. They don't need to have the healthcare services. What they need is to have their health. So we have to empower our community to say that now is they themselves who have to control and to have good health, which is determined by themselves. Okay, in order to have a good health, so they have to participate in all those activities which to lead them to have a good health. So the participation, the empowerment is very important. So how to do the empowerment? It is already done, but what we need to do is to have the strengthened program to go closer to the for the community, and now is the time for them to really participate in that strengthening program. All right, gap in understanding. So now I would like to remember I did mention on the two different categories of stunting. So the variance in the definition. So remember, if you look at in your definition, is there any categories of stunting? Majority will say those below under 2 standard deviation, right? So they are considered stunting. But you remember the one that they have the definition, it might be varies from countries to countries, all right? So what is applied to America may not applicable to in Indonesia, because we have a, or even in Malaysia, because we have a different population profile. So the definition has to be what I call that reconsidered in terms of the area of where it is used, right? Number additional contextual challenges, sustainability of the progress. So this is where sustainability is very challenging with these global issues, as somebody else mentioned. Global health is always affected by the war, by the disaster, and so on. So the sustainability will be affected by that, which is beyond our control. Okay. So this is some of those challenges that we have to look into that. Another challenges is that in terms of empowering the community, we always look at the medical model, but we sometimes overlook on the community development model. So the thing is that in the community, we have to involve the community, we have to involve the academician, we have to involve the government. Then only the sustainability of the empowerment will be improved. So they have to relook into the contextual framework of the empowerment. All right. Now, this is innovation in the technology to improve overall program efficacy. So if you look at here, there are so many of these innovation in how to overcome this stunting. So if you look at my slides here, we have many digital tracking in terms of nutrition improvement, intelligent application of stunting monitoring, so which is very good. But the thing is that, is it being utilized by the Indonesian per se, or is it only localized? All right, one. Number two, when I look at some of those articles on these on the innovation, what we are lacking is that there is no application which will be able to early detect on the children who is about to go to stunting. This is very important. As I mentioned earlier on, this is the warning sign. We are talking about the warning sign. Okay. All right. Another challenges that need to be improved is that the multiple form of data used to inform the program planning. So based on my search with all those data, maybe I did not survey more, but majority which I observe, is that the research which is done is more on the perception and attitudes. So in order for you to improve, for the research to improve, is to have some action research, whereby you can see the outcome in terms of the targeted clinical presentation. So you should be able to improve on the status of that stunting rather than you improve on the knowledge as well as the attitudes. All right. So this is some of those WHO recommendations. So there are so many recommendations. Okay, there are so many recommendations that been given by WHO, but I think it is all implemented by all the countries. But each of those countries have their own policies and practice in order to suit with their requirement. Okay. Again, this is another recommendation. They say we have to have a very good framework, strong commitment, and all those things. We have no problem in Indonesia, right? And of course, they say it is good to have the capacity building on application of the Opti-Food program at the local food environment for recommendation and nutrient intake to reduce maternal anemia among pregnant women as well as children. And then the production, health, education, and service among adolescent and pre-marriage women, which is already in place in Indonesia. Development health curriculum for school children, I think it is also in place, and development of health action plan for mother and newborn, neonates, and school-age children and adolescents, which is already been implemented. So in conclusion, in my my presentation, the 5 pillars that Indonesian government has set up is a very good program in accelerating the stunting reduction for sustainability of development goal by 2030. And it is an excellent program, which you can see there is a reduction of the intermediate outcome among most countries. Okay, we are talking about the intermediate outcome, all right? Community participation and empowerment is the key factors to shorten and improve on the medium and long-term goal. So you need to have that empowerment. So how are we going to empower? Again, we say the way of how we're going to use our technology platform is how to improve their empowerment of early detection rather than to look into their perception and their knowledge. Technology appropriate research and innovation allows opportunity for empowerment when it is used appropriately. All right. Again, I emphasize more on the early detection there. If innovation are easily adopted and accepted by the community, they will continue using it for the sustainability of their behavior. All right. People empower themselves. All right. So this is what Prof early on said. Now we have to empower themselves. Health is on their hand. Okay. However, government and other sectors can play a vital role by facilitating the process by providing support environment, policy, institution, and research as well as development. So this is to answer on the previous question, said, what if some of those rural areas would not have the facilities of internet? So this is the policy, the goal of the government to provide affordable environment so they can use in future society 5.0. So the community development is important to incorporate, but it has to be incorporated in a different approach. All right. So that's all about my stunting initiative. And terima kasih, semoga bertemu di Bojonegoro. All right. Okay. Thank you so much.
Thank you very much, Professor Farida, for very excellent presentations. Terima kasih. Thank you very much. And I think as the presentations, that community is become the first line, I think, to hand in hand, reducing together about the stunting. So we are as the health worker, maybe we can educate the people in sociality to following maybe the regulation from the nations to reducing stunting. Okay, ladies and gentlemen, I think we can move to the next session. This is the discussion session. Same with the first one. We have 30 minutes in the discussion. So please raising
Aman ya,
hand.
kalau ganteng. Kan juga bagi
I'm
sekarang
sorry, I phone can mute
Iya.
the speaker, please. Okay, well, okay. I repeat again to the audience. So please, if you have any question, please raise your hand using the feature on the Zoom or type your question into the chat room and I will read them for you, of course. Okay. Okay, I got the first question, I think. Wait a moment. Okay. Okay. Professor Farida, we got the first question from Mrs. Vivi Utami. She is the lecturer from STIKES Rajekwesi, Bojonegoro. Okay, I will read for you. Thank you very much. I am Vivi Utami, came from STIKES Rajekwesi, Bojonegoro. Expressing thanks to Professor Farida and Professor Bisma who have providing interesting topic and issues at this conference. Until now, the problem of stunting is still a big problem in developing countries, especially those with the large populations. I want to ask, what kind of practical prevention can be taught to mothers to prevent the stunting? So,
right.
Professor Farida, please to answer.
So how to prevent stunting? So how we're going to, am I right? The question is about how can we educate the mother to prevent stunting? Am I right? All right. Okay.
Yes.
So first of all, before we want to give them any intervention of how to prevent stunting, so we have to look at, of course, we have to look at their knowledge, right? So how much knowledge that they knows about what type of nutrition, what type of food that can improve on the health or the weight or the health status of the child. All right. So we don't want to ask them what are stunting orders, what is the reason for stunting. We want to know them, how they know, what they know about the importance of the food. Right? What food is good for the height, what food is good for the weight, what food is good for prevention from infection. Right? So based on that, then only we can provide them with all the health education on the types of nutrition. One, that is on the knowledge. Number two is that we have to look at their practice of their providing the food that they already know. What are the foods that now is the implementation? How they're going to provide the food? As said, it must be certain amount of carbohydrate, certain amount of protein, certain amount of vitamins, so that it can help them to have a good normal health. But we already given that. Now we want to know how do they prepare that. So this is all those information that we need in order to provide them with the good education, good practice of how to prevent stunting. And I remember, I'm sure in some of those places, they already conducted on what you call that demonstration on how to provide a very good food, all those cooking demonstration on those things. In fact, some of them have some, what we call that, booklet on that. So we can provide them with all those. But again, how can we monitor the one that we provide them with the knowledge. How can we monitor? They are following that information. They are following our recommendation there. So this is where we have to monitor. So whether they are providing the exact information that already given to them. So in other words, I can say that in order for them to get all those information, we want them to improve understanding. The good, very important point is that monitoring of the implementation, right?
Thank you, Professor Farida, for answering the questions. I think I can make conclusions that the key to prevent stunting, and we can educate to the mother. If we have, number one is knowledge. If we have knowledge enough about stunting, so we can socialize to the community, actually to the mother. And then we should have any option to provide the food, or maybe we can give the additional food like a vitamin, supplements, and etc. And the last is we should maintaining and monitoring always. I think I hope that's the conclusion, and I hope it can answering the Mrs. Vivi questions. Yeah. Okay. Thank you. All right. Next, we move to the next question, Professor Farida. There is the second question from our students, our Bachelor of Nursing student, and I read them for you. Assalamualaikum warahmatullahi wabarakatuh. My name is Putri Ayu Nurhaliza. My nickname is Putri. I'm from the Nursing Bachelor Study Program. I want to ask to Professor Farida, can stunting be cured, or can the growth of children with stunting return to the normal?
Okay.
Thank you.
All right. So what do you think about that? Can it grow? Again, as I mentioned earlier on, it depends on the how early you detect the child on the stunting. So this is where I say it is important to have a different categories. We cannot rely on the one blanket definition there, right? So when you say stunting means that below 3 standard deviation, then it is already in a severe, which will be the damage is already done. All right. So we have it can be rectified when the child is in the early warning sign. So that is important for us to have early warning sign markers so that we can prevent the stunting from getting worse. Remember, in any disease, also early detection is the best way of how to treat any disease, right? Okay.
Okay. Thank you, Professor Farida, for the explanations. Okay, guys, I think we still have 20 minutes left in the discussion session. Maybe there are still any questions to Professor Farida. Please raise your hand or type to the chat room.
Okay. Chat room, Miss Eva.
Okay, thank you, Mrs. Rahmawati. Please welcome.
I tell you in chat room is any questions.
Okay. Okay, this is the third question. Thank you very much, Mrs. Rahmawati. This is come from Mr. Miftah to Professor Farida. Assalamualaikum. Okay, I am Miftah from UMTAS. I really appreciated to Professor Farida of the awesome presentations, and I wanna ask about how to solve for those people who already got stunting actually for their family.
Sorry, again.
Okay, I repeat again. How to solve for those people who have already got stunting actually for their family.
Okay, so this is what you said, that is the family history of stunting, am I right?
Maybe, yes. Yeah.
Okay, so they have a family. Remember, stunting is not the family history, right? Stunting comes from the nutritional malnutrition factors, right? So it is not a family history. If you look at the Japanese people, they always say that the Japanese are always short. Remember? And those days they say Japanese are always short. But if you look at now with a good nutritional status, how the Japanese now, they are taller, sometimes they are almost as high, same height with these people from the well-developed countries. So it's not about the family, it's about how is the nutritional status of the child, right? So my stunting is not from the family history, so it can be improved with a good nutritional status. So most importantly is that the family should be educated on what are the balanced diet that they need to consume. One. Number two is that we as the healthcare providers, we have to be very sensitive with what they can provide to their own family. So if they are from, we know that they cannot afford to have certain types of food. So we should be able to give them some alternative or some option in terms of replacing the meat. What are they going to have if they cannot afford to have meat? So another thing is that those healthcare providers should have some way or innovation on how to make sure that they must have a good food, but not necessarily from the expensive food. Whatever local food that they can provide, which is equivalent to the property of protein and vitamins. So I think in our setting, they have a lot of that materials that they can use. So we have our, as the care providers, so we also have to have some knowledge of what are the alternatives that can give to them, all right?
All right, thank you, Professor Farida, for answering. But maybe the question also include about how to solve if in their family there is a stunting. So what should the parent do? I'm sorry. Okay, maybe how should the parents do if their child there is any stunting in their family? So Professor Farida, what should we do?
How to?
Yeah, how should we do or how to solve the problem if the
how to solve the problems.
Yeah,
all right.
if the family there is a stunting, maybe that's the additional questions.
So okay,
Yeah.
this is what my answer is that, you see, they have to improve on the nutritional status, right? And one is that the stunting doesn't mean that they are not healthy, right? So they have to improve on their health status, prevent them from getting all those anemia or those obesity and all other disease based on the types of food that they have to consume. And if the whole family is stunting, so we have to look into whether they are from the family history of the small framework. They have this small size family. When small size means the body size is small. Yes. Okay. So if the whole family is on the small size, because you can see from our genetic factors. So if our family are from the small size, majority our children will be on the small size. So, but some will be improved on the size based on their nutritional status then. All right. Okay.
Okay. Thank you very much for the amazing answer, Professor Farida. Then let's be move to the third questions, Professor Farida. This is from Windy, the bestseller of nursing students again, to ask the question. And I will read them for you. Assalamualaikum warahmatullahi wabarakatuh. My name is Windy Nova Rahmawati. I'm from the nursing bestseller from STIKES Rajekwesi Bojonegoro. And the question is, what are the risk factor or causes of stunting as an indication of chronic nutritional problems?
What is the
risk factors? What is
the risk factor?
Yes, causing the stunting.
Okay, what are the risk factor for the stunting?
Yes.
Okay, what are the risk factor? So of course we are talking about the malnutrition. So majority of these what do you call that, the risk factor, instead of some people who have poor in terms of the protein intakes for the development of the bones, right? So they have all those deficiency in terms of the micro and micronutrients. So when you have to go, when I say about the micro and micronutrients, so we have to, it is a very big area. So they have all those deficiency in that micro and micronutrients. So like, for example, the milk, they have protein deficiency, they have vitamin deficiency, all those. So that is one of the a few risk factors on the risk of malnutrition. All right.
Very much, Professor Farida, for answering. I hope it can make satisfied from the question from Miss Windy. Okay, there is still the fourth questions from Miss Eka Suci Denianti. And the question is, please can you explain what it means variance in definition stunting and example of it?
Variance, is it from my presentation?
Yeah.
Is it the variance in definition?
Yes, Professor.
Okay, so we are talking about I did mention on the definition here. So as my recommendation, okay, I think can you see?
Not yet, Prof.
Okay,
Yeah.
This is about the definition of stunting, as I mentioned during my presentation. So stunting, you cannot take a blanket rule of definition of stunting. Those underweight, those people who have short statures, because
I'm sorry,
according,
Prof.
okay,
Screen has not
yeah,
seen in here.
yeah, I think it should be okay. Okay.
Okay. We'll present.
Okay, all right. So I did mention here, the variance in the definition, as mentioned here, we have the international standard by WHO on what is stunting. The advantage is that it is overruled. What I say is the blanket, simplified comparison between the region on the countries. So the thing is that we cannot take these blanket rules as our definition of stunting according to our setting, because in certain countries, as I mentioned earlier on, that the standard is maybe applicable to their countries, but countries like all those especially in low income countries, where majority the population is all from the small size. So if we take that standard, what do you call that, definition, definitely all of our children will be under the stunting criteria. So this is what we say, the variance in the definition. So this is what, as I mentioned earlier on, sometimes, so this has to be looked into. whether do we need to have this blanket definition to be used in our country, which we know sometimes that is not applicable. So we have to look into how are we going to what you call that, improvise on definition, or in terms of the policy, or in terms of our criteria to put our children under stunting. All right. Okay. So here, as mentioned here, okay, disadvantage patterns of growth shown by the standard may be quite inappropriate in a particular region of the world. For example, India, where the children are considerably small than in USA. So it explains everything here. So we have to have the local standard of the definition there. More appropriate if the clinical decision are needed, if statistic analysis is used to adjust on the anthropometry for the age. So this is why I said it is recommended, if possible, we can, each country have their own criteria or own standards to look into the anthropometry or the weight for height for their own children. All right. Okay.
All right, Professor Farida, thank you very much. Very nice explanation. And we still have 6 minutes later in the discussion sessions. Maybe I will read the last question to Professor Farida. The question is come from Mrs. Rahmawati. And the question is there any specific education to young girls to prepare the prevention of stunting? As we know, that stunting starts from mother. And another way, some cultures seeing taboo when talking about marry child in youth. Thank you,
Yeah.
Professor.
All right. So how are we going to educate all these children? I think like in Japan, in Taiwan, where they educate the children from the school. So this is where it must be integrated in the school from the early childhood itself, right? And another thing is about as you mentioned about the stunting start from the mother. We have some policy have to be looked into early pregnancy. All right. So early pregnancy is part of the factors that contribute into the stunting for the children. Because when they have early pregnancy, they are not ready for not only their organs is not ready mentally and physically and emotionally, they are not ready. So at the end, it can be affecting the fetus in terms of low birth weight, which can lead to the stunting. So we have to educate all those young children of one is that they have to have their empowerment of preventing from early marriage or early pregnancy and get pregnant when they are ready. So even though if they are married early, but when they are ready to get pregnant, then only they can start their family. So in terms of the preparedness of the pregnancy. In terms of the food, I think how are we going to educate our children? It must be from the family itself, from the home. Remember, one of the factors is the child itself. So it must be from the family on how we're going to educate on our children of what is meant by the well-balanced diet. So if you look at our own practice itself, some of the mothers who have their preference. So some of the mothers who are not taking vegetables, I know that some of even my children know, so they are not taking green vegetable. So it will affect on their children, right? So some of them are very choosy on the food. So this is where, as I mentioned earlier on, if they are not taking that particular food, so what will be our knowledge in terms of providing them the alternative which is equivalent to the food that is needed for their growth and development. Right? So that is my take-off information for that. So it's based on the mother as well as the teachers. So for example, I think even in Indonesia, also in Malaysia, Indonesia, and everywhere, they have all those, what do you call that, food, bekalan, makanan, all those for the school children. So how many people do really monitor what type of food that is given to the children? Because everybody is eager to give on the food. So if they are obese, we still give them milk if they are this one. So the thing is that the supplement that we give is not appropriate according to the requirement of the child itself. So this is where it is very important to look into how are we going to provide the requirement of food, the micro and micronutrients that is needed by the children. Right? It's not about giving all. We have to give all the vitamins. We give all the vitamins. No, this is how and what should we give to the children. Right? So there are so many ways of, you can see a lot of innovation. In those days, I think if in Malaysia, those days during our young days, it is part of the curriculum to say that, you know, what are the good food, which are the bad food, all those things, I think, which is slowly dying off. And now people have not focusing on that. They assume that this knowledge can be given by the parent itself, but the parents have no what call that, monitoring on that, the knowledge that should be given to the children. Right? Okay, I hope that answered the question. Puan Rahmawati, does that answer your question?
Yes, thank you, Professor Farida.
Yeah.
Thank you, for Professor Farida, for very informative and very clear answer, I think, to all of us. Okay, well, ladies and gentlemen, I think the session of discussion is up. So before we close these sessions, let me to read the conclusion, from Professor Faridah presentation. And in this presentation, we can take the conclusion that people should empower themselves. However, government and other actors can play a vital role by facilitating the process by providing supportive environment, policies, institutions, and research and development. And we are, as the community, I think have the main role. We are as the first lines to increase a child wellness and also prevent the stunting, because we all believe that community is the first line to make or prevent the disease. So that's our conclusions today. So before we close our sessions, let me to invite the Vice Chief 3 of STIKES Rajekwesi Bojonegoro, Mrs. Evita Muslima Isnanda Putri, as Kepnes MKep, to giving the certificate to Professor Farida. And to Mrs. Evita, please joining with us.
Okay, this is Eva.
Okay.
Listen my voice.
Yes.
Yes, please.
Yes. Okay.
Okay.
So clear.
Okay. Thanks, Mrs. Eva. Honorable Prof. Farida. Thank you for your time to share knowledge about current issues in stunting management. And we are so grateful having you in our first International Health Conference today. Thank you so much. And this is a certificate for you as a speaker from STIKES Rajekwesi Bojonegoro. I'm so sorry we sent it virtually. And I hope we will meet in person with you to get another sharing knowledge and at another time. So sorry about our limitation. Thank you very much.
Thank you so much. Thank you for the invitation. Thank you for the support, and thank you for the attention, and thank you for all the questions.
Yeah. Thank you very much.
Yes. All right. Thank you very much to
Yeah.
Professor Farida and Mrs. Evita. But wait a minute, and let's we take a position to take the documentations by the operator.
Yeah.
Okay, all of you have ready, guys? Okay, I will count on and please take your position. And 3, 2, 1, cheese. Okay, enough. All right.
Okay,
Thank you
thank
very
you so much. And thank you for the invitation again. And now I learn more on the Indonesian island, Utara, Selatan, and so because I always mix up. So when they said I'm in Bengkulu, so I thought it's all very close together. So when they say, oh no, we are in Surabaya, so I thought Surabaya is very near to Jakarta. So all are mixed up. So when everybody, I have a few invitations. So they said, I'm Padang. Oh, I say, and now I say, Padang is very close to Penang, right? So Surabaya is very close to Sabah and Sarawak, the Kalimantan area.
Kalimantan. Okay.
Right? So okay, now it's a very good design. So I hope that one day I can go to how you pronounce it?
Bojonegoro, Prof. Farida.
Bojonegoro. All right.
Close to Surabaya, Prof. Farida.
Yes, I've been to
Close
Surabaya. I've been to
Yes,
Surabaya
close to Surabaya.
To one of these college. And congratulations for your first conference. And it's a very good support from others. And it is a very good way of how we're going to communicate about the new knowledge. Thank you. Congratulations.
Thank you very much, Professor Farida.
Welcome.
Well, ladies and gentlemen, I think this is the end of the main session in this conference. So once again, I say thank you very much to Professor Farida who have been joining with us, give us many information that's very clearly to get by us. So thank you very much. And thank you for wonderful opportunity. And I think that we have both speaker, I believe, here, and we know that we are hand in hand to work together, increasing the global health based on the community. And I believe every profession is also doing their bit. And thank you very much once again to Professor Bisma Murti and Professor Farida for joining with us. And STIKES Rajekwesi Bojonegoro, our proud health institution, is very much appreciated for it. And for all audience, thank you very much for your kind attention to listen. And thank you very much for being a wonderful participant during the sessions. And hopefully to see you again in a real soon. And thank you very much to having me as your moderator today. Okay, wassalamualaikum warahmatullahi wabarakatuh. And I'll send back to Mr. Ari. Goodbye.
Oh, okay. Thank you very much, Mrs. Eva, for handling a wonderful discussion and wonderful presentation. I think it's very much experience and knowledge for today. Well, guys, minute by minute is run very well. I give 2 thumbs up for all the speakers today and also for the participants who has joining this program. And I do hope that we get much information from our conference today. Before we close this program, let's take the documentation. Is it right, Miss Eva? Can we get the okay, well, all the participants, yes, you can open your camera. We have 11 screens. So please let's take our documentation starting from number 1 until the last.
Okay.
Miss Eva, are you ready?
Yes, ready?
Yeah, okay. Let's take the documentation.
Okay. 3, 2, 1, cheese. Okay, wait a minute. Maybe move to the next slide, Mr. Ari.
Yep.
Okay, the next slide, yeah. Okay, 3, 2, 1, cheese. Okay, the third slide. Oh, wait a minute. Mister, sudah digeser ya yang di sana?
Ya. Something wrong? Not move. Oh, sorry. The
The
operator.
second
please.
slide.
Second
Please.
slide. The
Yes.
operator.
Second slide, please.
Is it the second slide?
Still not move here.
Try once more, Mrs. Eva.
Okay. Wait. I not find the bottom of slide.
Yeah, in the right side. Pojok, pojok in the right side, pojok kanan kah? Full screen, yes. Oh, okay, wait please. Okay, wait please for all the participants. We will take care about this problem. The operator will try to have your slide to get your picture. Ready? Yeah, okay.
Okay. Next. 3, 2, 1, cheese. Okay. Is there any slide, Mister?
Yes, next slide.
Okay.
The
Okay.
third slide.
Okay. 3, 2, 1, capture. Okay. The next slide. 3, 2, 1, capture. Okay. Is there any slide, Mister?
Yes,
Okay.
next.
3, 2, 1, capture. Okay. Next.
Yeah, the sixth slide. Six.
Okay. 3, 2, 1, capture. Okay.
Okay, wait, the seventh slide.
The seventh slide. 3, 2, 1, capture. Okay.
Yeah, okay. The
Next.
eighth slide.
Okay. 3, 2, 1, capture. Okay.
The ninth slide.
Slide. Okay. 3, 2, 1. Okay. Next.
The 10th slide.
The 10th slide. 3, 2, 1, capture. Okay.
Okay, and the 11th or the last slide.
Okay, the last slide. Okay. Take your position and 3, 2, 1, capture. Yes.
Okay, well, very well.
Okay.
Thank you very much, Mrs. Eva, for taking our picture.
With pleasure.
Okay, now it's time to end the program. I, as the master of ceremony of this conference today, and all of the committee from STIKES Rajekwesi Bojonegoro, say gratitude for all the speakers and for all the participants. And we also apologize if we have some mistake in our conducting this program. Thank you very much and keep healthy. And I remind you, please fill the attendance list for getting your certificates. Okay. Nah, thank you very much. Goodbye. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you, Professor Bismamurti. Thank you, Professor Padre, and all participants. Di end langsung aja, di end aja.
Very much.